Hi, and welcome to another episode here of The Nursing Show. We're here in Atlanta, Georgia at the Preparedness Summit brought to you by NACCHO, the National Association of County and City Health Officials. I think I got the order right there. We are going to be talking about a variety of topics on the shows that you're coming here this week, but we're going to start off with something that we actually talked a little bit about when we were covering this event last year, which was the Nurse Triage Project. And that has actually changed names and a little bit of its dynamic. And I thought we'd bring Lisa Coonan back and talk a little bit about, first, what is FluOnCall and why did we change the name?
Well, thank you for having me today. So FluOnCall is meant to be an integrated network to be used during a severe pandemic to help sick people figure out where they need to go to get care, to speed up the access to antiviral medicines, and to give information to people who aren't sick or caring for someone who are sick, but just need information. I'm really pleased today to have partners with me at the table. Lisa Austin from United Way Worldwide 211 and Jim Blumenstock from the Association of State and Territorial Health Officials, who are key partners in this project.
Now, why did we change the name from Nurse Triage Project to FluOnCall? Was that for branding for the public's purposes, or?
Well, you're right. The word triage isn't exactly in everyday language, so that's one thing. But the other thing is that we'll be using the medical professionals from poison centers to staff this triage line. And those medical professionals are not only nurses, but pharmacists and medical toxicologists and others.
So let's talk a little bit about how this is going to work. Obviously, people are going to be calling into different agencies and organizations. I guess, well, first off, somebody would call into United Way 211.
Well, actually, there's going to be a 1-800 number, a toll-free number that folks would be dialing into. And that line's going to be supported by 211 specialists across the country. They're going to be dedicated to the helpline, and they will then triage to find out, well, if someone's sick or caring for someone that's sick, and immediately send them off to a medical professional. But if they're looking for information or even local referrals related to the flu, then the helpline would assist them with that.
We're really fortunate to have United Way 211 as a partner because the 240 United Way 211 centers all across the nation, they do this every day. Their specialists take phone calls from the public and give out information in a helpful way every day. So we're really fortunate to be partnering.
How does this affect the state level response? I mean, obviously, you guys, the flu is coming around and is wrapping up for this year soon, but will come around again as it always does, or a major event may occur. How does this affect state level planning?
It really does, and hopefully over time it will add great benefit to our planning and preparedness efforts. You know, as Lisa mentioned, both Lisas mentioned, the two primary purposes is to provide timely, accurate information to the public, whether they are just worried and they need information or they believe they are really needing treatment. And then the other aspect is obviously the most appropriate, efficient guidance to receive the treatment should they suffer from the symptoms of influenza or pandemic. So the state health departments and local and county and the tribes and the territories will greatly benefit from this because the plan basically is to improve the status quo. The quicker we can provide information, guidance, and a support system to get ill individuals to a proper treatment modality, the better off they will be, their family will be, and their communities will be. So the purpose is really these explorations are to find ways to do a better job within our mission to basically serve the public.
And if I could add to what Jim was saying, you're completely right, but an added benefit would be to decompress the surge on hospitals and emergency rooms. So if fewer people need to go out and seek care, then the less stress it'll be on healthcare resources.
And that really impacts the system from everyone from the 911 ambulances that are getting called to sick persons all the way up to the surge, like you said, in the emergency departments and hospital overflow. What would trigger an event to use this system?
It's a great question. You know, every day our healthcare system serves the public, and they do a great job. We don't want to disrupt that. We would only implement FluOnCall if there was a severe pandemic and there was a struggle with meeting the needs of people. If lines at doctor's offices and emergency rooms were so long that treatment was being delayed, then we could implement FluOnCall.
And from a public health perspective, you also have to realize that this is not the only function or responsibility state health departments have. They will be doing disease surveillance. They'll be initiating a national vaccination program, in addition to giving education and information to clinicians, to the public, and ensuring that the antivirals or the medications are in place. So, it is a full plate. So anything that we could do to basically allow them to be, improve their efficiency, their throughput, and their advice to the public, recognizing that they have a number of balls in the air during a pandemic situation, I think the better off the public will be and be better served.
And I just want to add something to that. Generally in a H1N1 or a pandemic, some people are concerned or they have questions out of fear. This helpline will help answer questions and provide information to the public where they don't necessarily have to call their doctors or the pharmacy, etc. We can provide some very basic information, immunization centers, whatever they're looking for that's not immediate or urgent, and we can help stem some of those calls away from the medical providers that are actually helping those that are sick.
And in fact, we're creating linkages between ASTO's members, which are state health departments, NACCHO's members, local health departments, and 211. So 211 will be able to give relevant information based on where that person is living or calling from, and they'll have an access to that information for them.
That's so valuable, because you're giving that regionalized information. It really helps stem some of the hysteria that can crop up if you can give them real information based upon their own location.
And every day, if you need to see a doctor, one facility might be crowded, but there's usually somewhere else you can go. We're envisioning during a severe pandemic, hospitals and ERs with hours and hours of waiting time, doctors' offices, phones ringing off the hook, people really not being able to access their usual site of care. So this serves as a backup system for folks, gives folks a place to go. So if they're sick, they can get treated in a timely way.
And I mean, the beauty of it is it's using existing systems and existing relationships and just broadening and enhancing them to address the specific need associated with a pandemic. So we're not starting from scratch and inventing new infrastructures or new features. It's basically a refinement of what exists to make it, bigger, stronger, and faster.
And I know that it's an elegant solution to do it that way, really, because we have the poison centers and other resources like them that are proven to reduce ER visits and ER and hospital admissions, because we are able to treat some things at home, manage some things at home.
Exactly. I mean, our Poison Center colleagues aren't with us on the panel today, but the Poison Centers are staffed by nurses and pharmacists. They are experts at triage, and they have a great track record of keeping over 75% of their callers safely at home. So they know how to do this.
Excellent. Well, Lisa, and Jim, thanks so much for
this opportunity.
Thank you.
And it's important to get the word out about these things, so I welcome you next time to come back on and talk about the next exciting project you're working on.
We'll be glad to do that. Right now, we're not doing any public-facing work on FluOnCall. We're really just trying to speak to our state and local colleagues who are doing planning to work together to do this. But we always have exciting things to share, so we'll look forward to doing that next time.
Well, it's all about that readiness, right? I mean, it really is preparation, and that's why we're at the Preparedness Summit.
Yeah, there you go. Good point.
So great. Well, thank you very much for
Thanks
coming
for this
on.
opportunity.
Thank you.
Thank you.
And I want to thank all of you for checking out this episode of The Nursing Show. For more of segments like this, you can find us over at promednetwork.com and, of course, over at NACCHO.org for all of the segments here from the Preparedness Summit. I'm Jamie Davis, your host, and we'll be back with more soon.